Hi, I am Dr. Manuel Nothelfer and I'm one of the founders and CEO of Wellster Healthtech. Let me explain to you what we do. We enable happier and longer lives for everyone. We in Germany have one of the best healthcare systems in the world. However, our existing system still works in silos and is largely reactive. It has few preventive mechanisms and offers little convenience to patients. Patients often have to wait a long time for medical appointments, or in rural areas even travel long distances for them. And checkups are incentivized only from a certain age on. So there's a very high need for digital support for the existing system. By combining the best digital and analog medical solution, we at Wellster are spearheading the evolution to a human-centric and holistic healthcare system. Let me explain this with a simple example. 25% of all men over 35 have erectile dysfunction or experience it at least once in a while. Ought to address in a big audience, but it shouldn't be. Because this possibly also affects someone in this audience. So 25% of all men over 35 have ED, and a full two-thirds, let me repeat this, two-thirds of them with a serious cardiovascular cause. Fair to say that the penis is the men's health antenna. Despite this alarming number, today only 20% of ED patients are on treatment. 80% are untreated, which is about 6 million men in Germany alone. The reason for this are shame, complexity of the condition, but also the healthcare system which is not actively addressing the problem. The solution? Proactively addressing men by integrating everything from the initial consultation to the prescription and shipment of the appropriate medication on a telemedical platform, gospring.de. According to individual needs, the patient receives ongoing care via video consultation, supporting digital functions and partner apps. Of course, not everything can be treated digitally. So if necessary, the patient will be recommended to a local specialist. In this way, over 3 million heart attacks could be prevented. But we are not quite there yet. Since the launch of Wellster in 2018, we've treated already over 300,000 patients. But why did we start with ED? The digitalization of healthcare and the integration of telemedicine solutions is progressing only very slowly in Germany. E-prescription and e-patient files have been postponed again and again for years. A system that we as a health tech company have long since established. In the case of ED in particular, it is clear that the analog healthcare system does not provide enough incentive for patients to get checked. Patients, on the other hand, are very well incentivized by telemedicine solution. By the way, we have conducted our own studies on this with the LME Munich, which proves this on a scientific basis. Patients were thus able to quickly recognize the benefits of telemedicine and are now also having other indications treated by us. But this is not just patients who benefit. We integrate a lot of stakeholders and thus drive innovation together. Pharmacies have a stake in e-prescriptions, and public health insurers benefit from a healthier population and thus lower costs. Medical professionals gain access to more lucrative patients for whom we have already performed the screening or initial examination. Participates in medical research and studies to optimize treatment options. And once again, outsource services it doesn't have the resources for to us as a third-party provider. In short, we enable all stakeholders to participate in the digitalization of healthcare. So, why us of all people? Why Wellster? I give you 4 reasons. First, we have created an ecosystem in which doctors, pharmacies, digital health apps, health insurances naturally find their place. This fully integrated system is unique for Germany. Second, the ecosystem puts the human, the patient, in the center of everything and puts their personal needs and individual support ahead of the needs of any other player or stakeholder. Thirdly, we have a European setup and have proven that we can operate successfully even in the most regulated market. And fourth, we have unbeatable medical expertise combined with us. Although guidelines for telemedicine are still scarce, we have institutionalized a medical board that is second to none, consistent of leading physicians and luminaries from all over Germany. The medical board not only is our medical and ethical North Star, it is also filling a void that politics in Germany are not ready to fill yet. There are not enough guidelines for telemedicine, so we are setting gold standards ourselves and live by example. In short, by combining the best digital and analog medical solution, Wellster leads the evolution to a human-centric and holistic healthcare system. By now, we have moved far beyond erectile dysfunction and serve not only urology, but also dermatology, psychology, lab testing, and brand new gynecology. MySummer.de is the newest addition to our healthcare platforms and is the best fully integrated femtech out there. 7 minutes. That's the average time a gynecologist have for their patients per treatment. Too little time to perform important tests. Individual consultation and treatment options often fall by the wayside in everyday practice. A digital approach can be a real relief for women. For example, if you have an acute bladder infection, you need a quick remedy and no waiting time in the doctor's office. The pill is by far the most widely used contraceptive in this country. Yet, there are still preparations on the market that are associated with an increased risk of thrombosis. Nevertheless, these contraceptive methods are prescribed anyways. Also, because the doctor's time and framework conditions don't usually permit any alternatives. We provide information on that matter and offer a thrombosis risk test with MySummer.de before the pill is prescribed, and then recommend an adequate contraceptive method. This kind of education and prevention saves lives. The morning after pill is also a real use case. Pharmacists complain about the weekend rush after sex incidents, which even requires extra staffing costs. It's an equally unpleasant scenario for patients who often find their voices lowered in the pharmacy. With MySummer, only a few precious hours pass from consultation to quick delivery. For women, telemedicine is an important convenience topic, and we are the first in Germany to fully serve this. The possibilities are endless. Our EasyDerma platform achieves amazing success in the field of dermatology via photodiagnostics. The EasyTest platform offers preventive examinations of all kinds for home use, as well as simple STD test kits, which are also distributed in educational activities by party events. Users send their samples to the lab independently, receive a result digitally, and of course, that's very important addition here, receive comprehensive further support from our doctors if necessary. Hello Easy is our platform for psychotherapy, a topic that has become more and more important, especially in the last 2 years, although the analog therapy places have by no means become more. Our products close gaps in care and relieve the healthcare system. And we are not done yet anytime soon. We will continue to expand also across borders. But first of all, we will further drive the digitalization of health. We already have AI-assisted analysis, but think about what we can do as soon as we move into more personalized, more individualized prevention. Based on collected data, we will be able to prevent diseases before becoming chronic or even lethal. We will make the world an even healthier place and happier one. Thank you very much. If you have any questions, please contact me via LinkedIn or our website, wellsterhealth.com. It was a pleasure being invited here. Thanks for having me. All the best and stay healthy. Goodbye.